I have had a problem with my right knee for the last maybe 10-15 years. I have had knee cartilage operations on it, maybe 4 of them. The first one was in the UK, it didn't work out. Came back home, had 3 more, it didn't work out. And slowly the knee was bending inward, and it came to a point where walking was difficult. And I went and consulted orthopedic surgeons at home, and all of them were saying it's a hopeless situation. For our country, we do not have the expertise, we don't have, in terms of equipment, in terms of doctors who can do that. So they recommended towards the end. At first they said, just bear with it. After all, you are an old man. You soon die. But after some time, I couldn't take it anymore. So I went back to one of the doctors. I said, no, we can refer you elsewhere where they can do this knee replacement operation for you.
He first came to me with increasing pain in the right knee since a year back. He had a previous injury to the right knee about 50 years back in 1971, where he had a first surgery for a cartilage damage. This was followed by a couple of more surgeries in 1981 and 89 for a further ligament injury sustained while playing football. So after 3 surgeries, the pain was reasonably all right, but he found that for the past 1 year, the pain had increased. Although he's an electronic engineer by profession, lately he was into a fitness instructor, and so he was finding that his work was increasingly becoming difficult. So when I saw him and we did x-rays to find out that he had an advanced arthritis of the right knee, and which was a grade 4, and the only treatment possible was a total knee replacement. So we counseled him and given him the choice of robotic knee replacement and the advantages which he gladly accepted. We went in with the surgery through the robotic procedure. Everything went well, and within 3 days he was discharged from the hospital, and he was reasonably comfortable doing his daily activities to the restroom and also a few steps without any pain. This patient is a 74-year-old gentleman, and to say that there's no barriers or any restrictions for doing any robotic joint replacement surgery. In fact, for the elderly, it may be more beneficial because of the lesser post-operative pain they have to endure in these cases.
If I meet anyone that needs that kind of attention, I cannot refer them elsewhere. I'll refer them to here, and I'll refer them strictly to Dr. Sunil because he's very, very good.